in the room because usually when you give talks about the skin and the word beauty sometimes gives it a sort of like a stigma. Guys, just stay away from this kind of talks. So I really wish that there were more guys. But anyway, I will just a brief introduction as to who I am. I'm Dr. Mazlin. I am a dermatologist. I've been here in this hospital quite recently. I just started working here for about almost 3 years here. All my life I've been working in universities, either in the northeast of Malaysia or even in Kuala Lumpur. But I came out, to join the dark side about 2.5 years ago. Yeah, I mean that's how sometimes you're public and private. That's how the view is. But anyway, I chose this topic mainly because in my clinic, very often, patients come asking me, some questions about, okay, what is this for? Can I undergo this treatment? And I notice that they don't really understand. There are a lot of things that people know of, like they've heard of collagen injections and all that, but you don't really know what it's for. They know the name Botox, but they think that it's for whitening. There are lots of misconceptions. Yeah. Okay. So I thought I might just as well, just give a talk, and hopefully, at least all of us in this room would have learned something by the time we leave the room. Okay. All right. So let's just start. All right. Now, when we talk about beauty, okay, the perception of beauty, it varies, okay, in different parts of the world. All right. I mean, as you know, in Malaysia, for instance, this is not in Malaysia, but this is basically the human Ken and the human Barbie. It can be the idea of beauty, to some people, though it might be a bit, a bit unrealistic, but depending on which part you're coming from, having a long neck covered with golden rings, that's an idea of beauty. All right. In Asia, for instance, this is probably the kind of look that some people want, and in Malaysia, more at home. Yeah. So, just in case you don't know, choose the odd one out. The one in the pink tudung is actually, for those who don't know, she's one of the cosmetics millionaires, we call it. She started off, she's an entrepreneur. And now she's a very successful businesswoman selling her own line of cosmetics, and she's made a lot of money out of it. And I assume that when you are a millionaire, cosmetics millionaire, you can look the way that you want to. So obviously, this is her ideal perception, her idea of beauty. Okay, right. So it varies, right? And these pictures I took from a study that they actually did. They photoshopped. And just same model, but they Photoshop all the different looks or makeup, how in different countries, how people perceive beauty, yeah. And for men, let's not leave them out. You see, only Egyptians want six-pack. Other parts of the world, they don't really care. Oh, okay. And also Philippines, yes, Philippines, yeah. Only these two countries want six-packs. The rest, they're okay with, what do they call it?
Pack.
Daddy bod. Yeah. Yeah?
One pack.
Yes, the one pack, one cake. Yeah. They're okay with that, so. All right. And so what I hope to do today is to make everyone aware. Yeah, there will be several treatments I'll be touching on, and so that you can, when you know about these things, you'll be able to choose which one you want to go for and which one you think that, this is not for me. All right? Okay. Now, to achieve beauty, all right? Now, women are willing to go through anything. Yes, yeah. They're willing to go through anything from your normal face spa to gold masks. Yeah, to snail mucus, okay? They're willing to do anything, okay? And for your information, nowadays there's actually a whole line of cosmetics, skincare, cosmetic or skincare product that are manufactured using snail mucus. You know the slime that comes out from the snail? Yes, I tell you, people are willing to do anything for beauty, okay? Yeah, that's why I also get some that I have had people asking me, Doctor, why don't you start your own cosmetic, line? I said, no, that's not what I'm here for. But anyway, caring for our skin, we can start from the simple ways of just washing your face. You'd be surprised, I have patients who come to see me with a very oily face and they have got pimples, pimple problems. And when I ask them, do you wash your face? No. All right. So we can just start with that. Especially guys. I don't know, somehow, I don't mean to generalize, but somehow the men folk, they don't really see much in, the benefit of washing our face. So you can just start simple. Start simple with just washing your face. And this is one of the questions that I always get asked. Must I use the 3-step skincare system? You know what 3-step skincare is? Yes or no? Do you know what it is? Yes, this one. You see, when you go to the shops, Sephora, whatever brand, cosmetics, they will always, you must use these 3 steps. Clean your skin, tone and moisturize. Now, if you ask me my personal opinion whether you need to go through all this, no. Okay? To me, it is it's like trying to include as many things as possible when you sell things. It's to make as much money as you can. But having said that, it depends on, of course, you all know. When you choose a cleanser, toner, and moisturizer, normally, they cater for different kinds of skin types. Yeah. So if you've got oily skin, your cleanser is usually a bit more harsh. They have more bubbles. Yeah. Usually they have more bubbles because you want to wash off the oil. The toners are usually normally they contain a bit of alcohol to make sure you don't leave any oily residues after washing. And they claim that they can make your pores smaller. All right. And of course the moisturizer, because it's oily, normally it's very light, basically water-based moisturizers. That's the usual trend. And when you have, dry skin or sensitive skin, the cleanser usually comes in the form of a milk. No foams, because we don't want to, when something has foams in it, you have to have soap. Soap means SLS, sodium lauryl sulfate. And if you have dry skin, you use soap, it will really wash off all the oil, whatever little oil that you have, and it will make your skin even drier. So normally, for products that made for dry skin, the cleanser will usually come in the form of either milk or a cream. It won't come in a foam. The toners are usually, very minimum alcohol, because you don't want the water to evaporate so much. Yeah. And the moisturizer are usually thicker, heavier. And if you have combination skin, they normally they produce products that's somewhere in between. So it depends on, of course, I'm not here to say that don't use toner. You can use toner. But I wish that you have the information, so it's up to you. You can use toner when you feel like you need toner. On certain times, it's not a must that you use toner. Toner, basically, they claim to, after you clean your face, they claim to, toner is to make sure all the cleansers are washed off, before you put your moisturizer. That's one of the benefits of toner. And the other thing, which I never could understand, is toners are supposed to stabilize the pH of your skin. Now, pH of the skin is really something, if you are in the business in making cosmetics, you can really scare people off by telling them, oh, other products, they are not pH, doesn't normalize the pH. Our product, it's actually a selling point. So some of the toners are, if you read about all these things, some cleansers are soapy, and when they're soapy, usually they're a bit acidic. So the toner are usually a bit of alkaline. So it's like you use one acid, and then you use an alkaline to neutralize it. So sometimes, I figure, why don't you just use a normal cleanser that is not too acidic and not too alkalinic, and you can bypass the toner. It just makes sense that way. But that's how it goes. Yeah, this is we're talking about $1 billion industry, cosmetic industry. So, yeah, and this is the other famous question, a common question that I always get. Which brand is best for my skin? If you ask me, there is no best brand. You know, it depends on what it contains. There's no one best brand. But if you have sensitive skin, please stay away from things that has perfumes in it, things that has colors in it. Yeah, there are lots of, for the young ones, you know, our teenage daughters or teenage friends, you know, they are usually attracted to products that has a lot of color and are marketed by, you know, using all this, you know, supermodels and famous celebrities, and you know, so normally if you have sensitive skin, go for the ones that scent-free, that does not dry your skin, not much foams. You'll be all right. Okay, just stick to those. They might not even look as glamorous, yeah, as the cosmetic products, but usually they're quite easy on the skin. Okay, now the other one, this is very common. Okay, a lot of people feel that when the product is organic based, it's natural, it's chemical free, and therefore it's safer than normal product. I assure you this is not true. Again, this is another selling point. Okay, to make your brand, if you have a brand, you say it's organic, yeah, and you charge it a bit more because it's organic. Yeah, they always, the word organic, right? And because I have treated patients who develop problems on their skin using organic products. Okay, homemade organic products. How they learned how to make it is usually from the internet. Yeah. They can mix honey with cinnamon and as a treatment for acne. I've treated patients who burn their skin with cinnamon or with garlic. Yeah, put meat. Yeah, and you know, we end up having to treat the scar after that. So what organic means usually is that yes, they are plant-based or fruit-based or vegetable-based. They were planted organically means yes, they did not use chemical, you know, fertilizers, and you know, they really adopt all the organic farming methods, which is true. But the things that they use is still the same thing. Yeah, to make something work, you still need the same chemical. You use, let's say, you choose to use turmeric, for instance. Okay, let's say you choose turmeric because it has got antibacterial property. Yes, turmeric has antibacterial, antifungal property and all that. But what makes it able to kill all these things? There must be something in turmeric, in a certain chemical that enables it to do these things. So you cannot run from chemicals. Chemicals doesn't mean, the word chemical always mean that, oh, it's man-made. That is synthetic. Chemical, you know, you can get chemicals in even in durian. What is the chemical that causes problems with durian? Have you tried durians? Since you've been in Malaysia, please try it if you haven't. But you know, yeah, no, durian. That's why, you know, it's associated with you hear stories, people eating lots of durians and they get a stroke. Yes, durians has certain chemicals inside it which causes your blood pressure to shoot up when you eat a lot. Okay, so you cannot run away. Using the word organic doesn't mean it's chemical free. Yeah, this is one of the myths that I hope you hold on to. All right, but of course it's a free country. It's a free world. Yeah, you can use it as long as it doesn't do you any harm. Please, by all means, go ahead. Okay, we go now to beauty treatment. Now I've just touched a bit on things that we do at home. And now we go to things that you have to leave your house normally to do all this. Okay. Now the first thing. These are questions from patients. Yeah? Can Botox brighten my skin? Now, how many people here think that Botox can brighten your skin? Can you lift up your hand? Or you're not sure whether it can brighten or not? Yeah? Botox, the name Botox is botulinum toxin. It is a toxin that is produced by a bacteria called Clostridium botulinum. Okay? Now, Clostridium botulinum is a bacteria that when it infects a human being, it causes you to be paralyzed. Tetanus. Have you heard the disease called tetanus? Yes. Clostridium botulinum causes, no, sorry, not tetanus. No, it causes parasite. I know the name escapes me. But what it does is that it paralyzes. How it paralyzes? Botulinum toxin blocks the nerve. The nerve doesn't work. Okay? But you know, science being science, people, very clever people, took the toxin, purified it, and use it as treatment. Use it in medicine. In medicine, it is used to relax. You know, not only for beauty. You know, there are people with contractures where the muscles are stiff. Yeah, muscles are stiff either on the limbs or even on the face. You know, making them, you know, grimacing, and the face is stuck like that. So when you have patients like that, we use Botox. We inject it to paralyze the muscles, and so that the muscles can relax. Okay? So Botox does not brighten anybody's skin. Botox paralyzes your muscle. And why do we want to paralyze our muscle? Okay? Why? These are the areas that we inject, okay, with Botox. Now, again, why? Is it to get this kind of totally frozen look? You know, some people like this. It's totally frozen. What is wrong with this beautiful lady? Do you see any lines?
No wrinkles.
There's totally no wrinkle. Her skin looks like marble. Yeah? She can be passed off as a vampire in Twilight. You know, if you read the novel. Incriminating part, evidence though. But, you know, it's totally wrinkle-free. That is what Botox is for. You inject it into the muscle to paralyze the muscle, so that when you won't have lines like this. So obviously, you see, I didn't have Botox. You see, I frown a lot. All right. So if I had Botox, I wouldn't have this. All right. So this is what they try to achieve. You see the one here? Yeah. We tell them, okay, please frown. You see that? And after Botox, please frown. Oh, she's trying to frown. She's trying to frown, but that's a frown or lack of. Okay? See, this is the glabella lines, we call it. You know, I got lots of that, you know. I think a lot, worry a lot, that's what you get. And then we tell them, okay, again, crunch your nose or, you know, frown. There. Alright? If you don't put too much Botox, you can still, you know, look very natural. You don't look frozen like that. Yeah? And normally that's what we want. Alright? Now, that's, okay? Now that's Botox. That's Botox for you. Okay, Botox is not without problems. Alright? The Botox injection, can you imagine if it goes into the bloodstream? That is that is the most feared complication. Injecting Botox into the bloodstream, it will make you paralyzed. Yeah? Now when you inject Botox into the right place, the muscle stays paralyzed. It's only certain muscles, okay? There are certain places, I showed you the areas, the targeted areas, depending on what troubles you. Only those areas will be treated. But the effect usually can last for about maybe 6 months to a year. Yeah? It depends. If the muscle works very, very hard, then the effect will run out quicker. Yeah? So if you frown a lot, it can go up to maybe 6 months or maybe a bit more than that, 6 months to a year. Okay? I've tried Botox. I've tried, trust me. Obviously not recently. But I think it went, the effect I could see about 9 months. It lasted for about 9 months. Yeah? I mean, I tried. Not because of anything. I want to know how it feels like. And then you want to see, you know, how much pain you can tell patients later on. And just to have a feel. I like it, actually. You know, because I got this. But, you know, it depends on what you feel that you need, really. Okay, now, how about collagen? Yeah? How about collagen? Some people call it collagen. What do you understand from the word collagen? Now, when I talk, collagen, do you know what it is?
We lose it as we grow older.
Very good. Oh, I got a science PhD student at the back. Pressure. You know, sometimes when you give these kind of talks, you know, I try, when you think, I'm going to give a public talk, so I don't want to sound too scientific and put you guys all to sleep. But at the same time, if you don't go into science, you end up sounding like a beautician. Isn't it? So it's difficult to okay. Now, when you talk about collagen, what you mean is actually fillers. Fillers are things that, we inject it underneath your skin, mainly to fill in the gaps, fill in the areas which are now thin. Yeah? When I talk about fillers, I have to talk about aging. Okay? Now, this is where the fillers are usually injected. You see, this is the epidermis, the top layer of the skin, this is the dermis, and then you have the fat. So it depends on what kind of wrinkle, we're trying to treat. Okay? Theoretically, it's like for fine wrinkles, something we inject it a bit upper. For medium, in the middle of the dermis. For deep wrinkles, it's down there, way down. Okay? Types of fillers. Now, I wrote collagen at the top because, a lot of people think, oh, collagen. Collagen is hardly ever used nowadays. And I'll tell you why. Collagen, they are usually taken either from bovine or cadaveric. Okay? Cadaveric means they're taken from other humans, dead humans. Alright? But they don't last very long. So, with the newer technology comes in, so nowadays, nobody uses collagen any longer. People now, a lot of doctors or beauticians, or they shouldn't be doing it, but some of the famous ones are like this one, hyaluronic acid. Okay, hyaluronic acid, like collagen, we also have it naturally in our skin. Collagen and hyaluronic acid. Collagen is what keeps your skin supple. That's why, when we're young, our skin is supple. We're all still young here, sorry. We're all still young. But as we become more mature, we lose collagen with time. And then that's when, our skin sags a bit. When you pinch it, it doesn't go right back to its original position like it used to. That is because we lose collagen. And hyaluronic acid, basically, it's the area, these are the substance that fills up your dermis. So your collagen sort of like floats in your hyaluronic acid. Okay? So nowadays, people use mainly hyaluronic acid. Depending on the type, there are many types. Some can last up to 6 months to a year. These are all temporary, 6 months to a year. This one, calcium hydroxyl apatite, whatever. Okay, this one usually lasts for a bit longer, 1 to 2 years. Polylactic acid lasts even longer, maybe 2 years and above. Okay, so I just list down the names, alright? These are not the trade names, Sometimes, you know them as Juvederm, Radiesse, Sculptra, those are the names, the cosmetic names, Sculptra is this one, polylactic acid. It lasts longer. When we talk about the beads here, I just had to add this one, polymethyl methacrylate beads. Now, these are beads that they're not temporary. You put them in, you can only remove it by doing surgery. But people actually do that, put that underneath the skin. Initially, it was designed to be put in bones, in bones, but bones, cartilage, But then, things evolve and it made its way to the skin. So it's considered permanent. The one in red are temporary. So sometimes, a lot of people want a temporary, just a temporary filling. And then they go and touch up for like once a year, which is not too bad. Now, the last one is autologous fat. Autologous means your own fat. I find this very interesting because, we take your own fat, do a liposuction from areas that you want to get rid of the fat, take the fat and fill it up in areas where you need it. Okay? Now, but the only drawback is, of course, you need 2 procedures. The liposuction and then putting the fat in. So you need 2. And, autologous fat, the good thing about fat is that when you transfer fat, there are stem cells in the fat cells. So with time, you won't lose this. Most of it you'll lose, but you still retain. Some, maybe about 30 to 50% of the fat, and the ones with the stem cell, it will still proliferate, and you'll have a longer effect. Okay? Now that is the beauty of autologous fat transfer. That's the full name of it. Yeah? So these are fillers, okay, ladies and gentlemen? Fillers, they're not collagen. Alright, these are fillers. Alright, yes.
Sorry, okay. Follow these two. Is that equivalent to our Malay susu?
No, okay. Susu is okay. There is some similarity. Susu, yeah, susu is actually a Malay term. You know, in the olden days, for beauty, what women do is they inject metal needles, usually gold. Those who can afford it, they have it made of gold, and they put it underneath your skin. Yeah, it's considered as there's something mystical about it. Mystical, yeah, and it is believed that when you have susu, it's associated with some black magic as well. And you know, the story goes that when these people die, they find it very difficult to move on to the next world. Wow, that's a bit of yeah. But to be honest, susu is using metal. Now there are, even nowadays, it is something like a filler, because what the metal does is they put it in the dermis, the same place, and what it does is basically there is some it causes inflammation, so it promotes they say inflammation in those areas, causing more collagen, you know, to your skin will produce more collagen. So in a way, it is a more permanent form of filler. But I have to tell you, this gold under the skin thing, yeah, it is even now there are people who put gold nets. No longer a one single needle now. They come in nets. You can actually, of course, you know, the technology is not done here, but there are people who have gold nets, made of nets, mesh, and they put it under the skin. So that's a more modern form of susu now. People have gone beyond that. Yeah. All right. Yes.
Excuse me, what does net means?
Net, jaring.
Oh, net.
Net, jaring. Net made of very fine gold. It's like a hair, the size of your hair, strand of hair. Strands of gold, netted strands of gold, and people have put it underneath the skin. It's quite popular in places like Philippines and Thailand, and now it has found its way to Europe. All right, it's done under a small surgery. It's considered a small surgery. Okay, so if you know, do you think that I've answered your question? Yeah. All right. Yes.
This collagen, is it the drink or this injection?
No, these are injections. Yes. Interesting subject you point. If you ask me, the collagen that you drink, you know, is it worth taking? To be honest, if you ask me personally, I think it's a scam. There are no scientific papers. I tried to look it up to prove that if you take collagen, you drink it, it becomes collagen in your skin. Because the moment those collagen drinks gets into your stomach, the acid will break all the protein down. It breaks it back into all the different amino acids, and it just gets absorbed. Alright? And that's all. But hey, people are becoming millionaires selling collagen drinks, yeah? Yeah. Yeah. So, yes, yes.
What about eating? Because like for example, I watched this cooking show in Korea. To get collagen, you make a soup made from. Sorry, you made a soup from fish cod head, because there's a lot of collagen inside the head. So if you drink it, you will get the collagen absorbed into your body.
Yeah, it's the same thing. That's what I say. You know, nowadays in the market, people are selling collagen from plants, collagen from animals. Look, we make our own collagen. Our skin make our own human collagen. I mean, just think it like this, you know, if you take a plant collagen, do you think it will change into human collagen? It doesn't make sense. If you take a fish collagen, do you think it's going to make it change into human collagen? It wouldn't even, you know, it wouldn't even go through our stomach. Our stomach has got a very strong acid inside. It will just break down everything. Yeah? So I'm glad you brought this up, because, you know, it's one of the myths. that I wanted to tackle today. You know, people make a lot of money, and you know, the other thing, please be careful when you see, you know, sometimes there are testimonies, oh, I drink collagen and I used to look like this and now I look like this. You know, normally these people, they don't only drink the collagen. They go through fillers, they do lasers, they do, you know, 1,001 things. Yeah? And then oh, this is me after collagen drink. You know, and there we are drinking the collagen day in and day out, waiting for our time to look like that. This is, you know, advertisement. Yes.
How about the lotion? They also sell collagen lotion, collagen cream, and serum.
Okay, yes. All right. This one bypasses the stomach. Very true. Very true. And do you know the technology? In order to make something to be able to penetrate your skin and get incorporated in your dermis, it takes a very high-tech technology. There is such a technology. And, you know, all those nanotechnology. Okay, normally the creams, they cost a lot of money. Normally, yeah. There is such a technology, but normally it's not really collagen, you know, it's a hyaluronic acid. If you look at it, it's usually hyaluronic acid with collagen. Yeah? And normally it's the hyaluronic acid is the one that they have made it very into small molecules, it can penetrate, yeah? And you know when you use it, yes, it sort of like plumps up your skin a bit. So it works. But those are usually the hyaluronic acid component. The collagen, they need to break it down to very, very small molecules for it to penetrate. Because our skin is made to ward off a lot of evils, you know? So it will, yeah. So it might work, but it depends on the technology behind it. Okay? Now having said that, you know, all this collagen and all this hyaluronic acid, when our skin produces its own, when in natural, you know, in a natural situation, when do you think we produce collagen? When? At night. Okay, maybe I should rephrase mine. In what situation? We produce new collagen when our skin is wounded, when our skin has an injury. We make collagen. That's how, you know, our body repairs itself. That is why, yeah, that is why lasers, dermabrasion, anything that injures the skin, that is what it's for. Okay? Okay. Now, fillers. Now, as I said, who and why? Who needs fillers? Why you need fillers? Now, that will be up to you, ladies and gentlemen. Because sometimes, you know, in this times, we have even patients here, very young, teenagers wanting fillers. And like, why do you want fillers? You know, you've got all your fat cells on your face, you know, full and, but you know, okay, I just want to share with you, you know, the face, yeah, when we age, yeah, it affects every single layer. We don't only age in the skin, yeah, the layers of the things that we have on our face. First the skin, and then you have your fat layer, you have your muscles, you have your bones, alright? So every single layer ages, alright, not only the skin. Changing the skin, you know, we lose our collagen, we lose our hyaluronic acid and elastin. Now these three are the ones that keep our skin supple, very firm and, you know, very nice. And when we lose it, that's why as we grow older, our skin becomes drier, becomes thinner, and becomes less elastic. It droops a bit. Okay? Now, for this, changes in the skin, so for all this is why they call it the rejuvenation treatment. Rejuvenation means we try our level best to make your skin, you know, increase the number, the amount of collagen, hyaluronic acid, etc., etc. Okay? Now, in the fat, we lose the fat. You see, first you got lots of fat, and then the fat just becomes smaller, and you know, the groups just become smaller and smaller. And you know, in between the fat, you have the gaps there. This is where the skin hollows up. And this is why people use fillers to bulk it up again. Put some volume in it. Okay? This is why you need an injection. You inject it there. Yeah? You inject it there. This is what fillers are for. Alright? Now, this is going to be very depressing as I go through this. But never mind, all of us go through this. And this is what happened, even the bones change. You know, our bones, not only they become thinner, they become smaller. They become smaller. If you have a very big face when you're younger, when you're small, by the time you know, it becomes smaller. Yeah? So the size, and our bones, there's nothing much that we can do, really. Nobody, you know, you just eat, prevent osteoporosis and things like that. Alright? So, this is basically just a diagrammatic representation of how fillers work. It's injected into the dermis, yeah? Where you, let's say this is a wrinkle. You know, like it's as if you have a piece of skin here. Okay? There's one wrinkle there. So you fill it up, and you push the valley, you push it up. Okay? Alright, why we inject it into the filler? Because if we inject it into an empty space, it'll start moving it, you know, to other places. We want it to stay there. That's why we inject it into the dermis, so there's something that holds the filler to where it's supposed to be. But even then, it can still sometimes, you know, migrate to the sides. Alright, now these are the areas, you know, that's usually injected. But, you know, when you go to have fillers done, you know, anywhere, you can, it's not really a must for you to treat every single area, yeah? Maybe you can just treat the area of the main concern. Your concern is where and where, you know? You always have a choice, okay? So you can, you know, fill it up. This area is you know, quite prominent in a lot of people, but I must tell you, these areas, injecting fillers here comes with its own set of problems. Alright? Yeah. You know, sometimes when you look at the advertisements, they only show you the nice photos. They don't show you the horrible ones. Only doctors get to see that. Doctors will get sued for it, you know. Now, fillers are quite alright elsewhere, but when you talk about treating the mid-face, you have to be careful. Okay, these are the nice photos I told you about. Yeah, I said. Yeah, you see? Plump up the nasolabial lines, for instance, yeah? It's still there. You don't want it to be frozen and look like you're all puffed up, but it's less, isn't it? Yeah, and look at the lips. Wow, Angelina Jolie lips. I tell you, Malay ladies, don't go for this. You know why? Sometimes, you know, our lips we are quite thick lips. And sometimes, I don't know, I mean, it's really up to you. But I think in general, you know, the Asian ladies, we don't really need much help in that department. We need a lot of help in other departments. Maybe not the lips, okay? Okay, that's the lip. Okay, just a few more. Hands, yeah? Hands, yes, yeah? Just to fill up the volume. And you know, when you have hands like this, now you can put on all your, you know, 2-carat diamond ring, 3-carat, whatever. Yeah, okay? So, I mean, these are, I'm not saying that this is what I promote. I'm not promoting fillers. Okay? Please don't get me wrong. I'm not here to promote fillers. I'm here just to tell you what fillers are made and that's it.
Do you do here?
Yeah? No, I haven't. Yeah, I haven't. I'll tell you why later. Okay. These are the ugly photos that the filler companies doesn't want you to see. Okay, now when fillers go wrong, this is what happens, okay? Now, this is when they overcorrect. But mind you, this is not really the doctor's fault. The patient wants it. This is the bee stung look. Yes, the bee stung look. You look like you've been stung by a bee. Kissed by a bee. Yeah? I mean, it's a look, you know, but, you know, again, fillers are temporary. So you'll get back your normal lip, you know, in about 6 months to a year, depending on what filler you use. Okay? And this is when the fillers, yes, got infected. Alright? Fillers get infected. They can get infected. You can see these are the places where it was injected. Remember, I showed you pictures, the nice photos, the nasolabial folds. Yeah. Why do I show you pictures like this? Do you know why? Because I'm not a beautician. I'm a doctor who have to warn you, you know, things like this can happen when you go out. If I'm a beautician, I'll just show you nice photos, I won't show you ugly ones. Okay, this is what we call a granuloma. Sometimes, some fillers, when they inject it, certain bacteria goes in. And then these things don't heal with normal antibiotics, okay? And taking them out is difficult also, right? Yeah, this is another photo of a granuloma. So these are things that can happen. These are scarier things that can happen. Okay, this is one of the most things that, in Asia, this is another thing that we Asians are just not blessed with, nice nose. We are just not happy with the way, our noses are. And we always look to the people in the West or in the Middle East, and we always envy their noses. So there are lots of patients who do fillers, have fillers done to improve, make it higher, change the shape. And the problem with our anatomy, we have blood vessels there. This can happen if the fillers go into your bloodstream. All right? Yeah. So you will have, a dead skin part of the nose can be sloughed off. Not careful. All right? So, this is the procedure. You can see the bruising. Yeah, the bruising, you do expect to see bruising after the injections. I'm not trying to scare you. Look at the nice photos. I'll show you the nice photos. You can look like that. All right? But, we are all, I just want you guys to be wise consumers. So you know the problems, and so go to a reputable place to do it. Go to a trained professional to do it. And we'll talk about it later. Okay. All right? This is a lady from Korea. This is the other problem with fillers and all these beauty treatments. You can be addicted to it. This is how she used to look like. She injected cooking oil into her own face. Yes. Cooking oil. So there are people who are addicted to fillers. Addicted to fillers. So they inject because fillers are expensive, and either they run out of the budget or something, or no doctors would want to inject them anymore, then they do it themselves. And this lady, that's how she looks like. You can actually Google her. She has the filler addiction. Initially, it worked well for her. She had some cosmetic surgery. She used to be a model. She had some surgery done, to make her look nice. And then it just, from there on, she just cannot help herself. She just keep wanting more and more. And at the end, she injected cooking oil. Yeah. Talk about, improving the fillers, yeah, cooking oil. Please don't try this at home. I do mean it literally and figuratively. Do not try this at home. Okay? All right. Now, this is another question I do get from patients. They come to my clinic. Because, to be honest with you, the bulk of my service is actually disease. I treat diseases, skin diseases. But yes, there is a small part that I do. Yeah, rejuvenation. Certain things I do. Things that I'm comfortable with. Yeah? I choose to be very honest with my patients. When I'm not comfortable doing a procedure, I would tell them, please let me refer you to someone I know who's good at it. And I know you will get good result and best care. When I don't do it. I don't claim to do every single thing. Okay? So I do beauty treatments, certain beauty treatments. But the main bulk of my work is treating diseases. Because that's what I'm trained for. Okay? Now, do I need laser? When I was posed a question like this, and I'm like, to be honest, nobody needs laser. It just depends, because laser is not life-saving. No insurance company would pay for it. Okay? Because it's considered as a cosmetic. Yeah, cosmetic. If you plan to go through a laser treatment, and have the doctor, write something that's not quite right, so that the insurance company, wouldn't know. It doesn't really work out well, yeah, because it's considered as cosmetic procedure. So, what what kind of condition need laser? I think that's a more, appropriate question. So lasers, do they work? You think they work? They work. They work. Okay, but of course, like anything, it has its limitations. It has its problems. Laser is not magic. Most patients, when they go through a laser treatment, they expect to see results. One, immediately, which doesn't happen, and they become very disappointed. Two, they expect to undergo the treatment only once, and that's it. These are myths. You can't achieve, the thing that you want to achieve by just having probably one session, or seeing the results immediately. Okay, and I'll show you why. All right. Now, when we talk about lasers, there are many kinds of lasers, but basically they are divided into lasers that cut. Okay, like for instance, the carbon dioxide laser or erbium laser. These are lasers that we use to cut things. There's a laser that removes or reduces hair, for instance. We used to treat people with excessive hair, or you have hair that you want to get rid of in certain parts of the body. And there are also lasers for treating pigments, dark spots, okay, pigments, right? So it depends on what you have and what you want to treat. Then the right appropriate laser will be chosen according to that. And sometimes we even combine it if the patient has got, both pigmentation problems and like acne scar, for instance, or for rejuvenation and pigmentation. So we can combine. All right? Now, this is how, when I the lasers that cut. Now, basically, I'm talking about resurfacing, or we call it fractional laser skin resurfacing. Fractional means, in the olden days, in the olden lasers, when they cut the whole skin, everything, and you're left with a very raw face after treatment. So it's a very, it's usually done under general anesthesia and all that, and they find that the healing process takes a longer time. So now what they do is, they still use laser that cuts, but they use fractional laser. That means only they comes out, and when you shoot them, they only remove small parts of the skin, leaving normal skin in between. So what this does is, you still get the effect, the skin heals faster, and you don't hurt as much, and that's how the technology has improved. So that's why we call it fractional. Fractional means it's not like the whole layer of the skin is removed, only certain parts of the skin. It's like it comes out, it looks like dots. Okay? So after you remove it, that's where you basically you're injuring the skin. You're making wounds in the skin, and that's when your skin produces collagen, elastin, whatever, to repair the wound. And when it heals, then you will get firmer skin. That is why you do not see the result immediately. The immediate result that you see is this. Okay, this is how it looks like. You see what I'm talking about? The dots, I say? Yes, Because, the probe is usually, it's like 1 centimeter by 1 centimeter. So when we shoot it, it's like stamping. So you'll get small squares, squares. But inside the square, if you look closely, there are all these white dots. These white dots are actually where the laser has penetrated. This is how it's going to look like. So you stay home for a couple of days, it's going to start crusting, this brown crust is going to come. Brown crust is just going to look like dots, on the small, all these white dots here. It's going to crust, they fall off in about 3 or 4 days. And that's it. You can go back to work and all that. Because now we are not removing the whole, the whole skin. We're just removing certain parts of it. Now, the healing is also different in different skin types, right? The darker you are, this is another drawback of being Asian. We tend to heal with pigment. Our skin produces color when we heal. So the problem is sometimes, if the power, sometimes some skin, some skin, even using the same power that we use for other patients, some patients develop what we call post-inflammatory hyperpigmentation. That means they heal with color. They heal, the thing becomes, once the crust falls off, you have brown spots. And then the brown spots will slowly fade, disappear. Alright? Now we see this in colored, people with skin of color. Mak Salehs, you know, yeah, the Caucasians, they don't get this problem. Alright? So please be aware of this. There is such a thing. That's why, you know, if you expect, oh, I'm going to have laser done, I'm going to walk out of that room looking like $1,000,000. No, you look like this first. And after you heal, you know, after the crust fall, you remember I told you about our skin is going to produce the collagen and all that. Yes, those things takes time. Okay, we have to wait for the collagen to come up. So you will slowly, gradually see the skin changing over the next few months. Okay, laser is expensive, but it's not magic. Makeup is magic. It can immediately get rid of your whatever, you name it, you know, eye bags, dark circles, oh, everything, magic, makeup. I should have gone to makeup school. My patients will be happier. Alright, doctors only give the bad news. Okay, so this is what happens, just to show you, yeah? This is histology, this is when you look under the microscope. So these are the holes immediately after laser. 2 days, you see, the collagen has started to come up, right? They try to make you see the collagen by putting all those yellow arrows there, all right? And then after 2 weeks, you see, the skin continues to make collagen. That is why if you go for this kind of treatment, laser treatment, you can even get by doing it like just for rejuvenation's sake, for instance. You can get by doing it once or twice a year, once a year. Yeah, it's a painful procedure. I think you can deduce that by saying this, which is why normally, you know, before we do this, we anesthetize the face. We use a cream to numb your face before we do it. This is to lessen the pain. Okay? Alright. Okay, pigment laser. How it acts. Now, pigment, you know, pigment usually, we use it to treat pigmentation, we use it to treat tattoo. It's usually the same machine. This is where the pigment is. Pigment can be quite deep, yeah? Alright, this is just a cartoon to represent. Basically, when the laser shoots, the pigment absorbs the laser energy. It absorbs the energy and it just, you know, it bursts into smaller particles. And then your body will absorb it. This is why, yeah, after treatment, you don't see much improvement yet. You only see a bit of pinkness in your skin, and that's about it. Because it takes time for the body to absorb. Again, don't expect to see the change immediately when you leave the laser room. Right? This is how the hair laser removal works. It's actually a laser hair reduction. Yeah? Now, what it does is basically when you shoot the laser, the beam, okay, it gets absorbed by the hair. Actually, it is the melanin in the hair. Melanin is the pigment, the color in the hair that absorbs the laser. That is why laser for hair removal works best in black or dark brown hair. Blonde, because there's not much melanin. It doesn't absorb well. So it will not work so well. The best combination is if you have dark black hair and white skin. You know why? Because the laser there's no contest. The laser can differentiate. Only the black, the hair will be absorbed. If we remove hair on a dark skin, you know, the contrast is not so marked between the hair and the skin. And when the contrast is not so great, the laser will find it a bit difficult to differentiate. Is this the hair? Is this the hair? Or this is the skin or what? So we ended up having to reduce lower power because when we shoot it, there is a risk that the skin will also absorb the laser. So the darker your skin, the risk is there. Okay? So instead of having you remove your skin, your hair, you can also remove a bit of the pigment on your skin. Okay? So basically we shoot And what it does, it basically, it heats up the hair follicle. So the hair follicle dies, and that's it. But laser hair removal, you know, hair, there are lots of reserves down there in your skin. So you remove it one time, you need to come for another treatment because the newer hair, the one underneath will grow. It comes in cycles. That's why for hair laser treatment, it is not wanting the doctor or the clinic wanting to make good business, asking you to come again and again. But that's how it is. The hair grows. New hair comes up and you have to treat it again. Okay? Alright. Acne scars. Okay? This can be treated by laser resurfacing, the laser that cuts. Okay? Acne scars, keloids. Alright, normally, you know, when we talk about all these diseases, all these conditions, it's not only purely just laser. Like keloids, we also, you know, use different things, yeah? Creams or injections and laser. Right? Combination. Alright? Fine lines. It works very well for fine lines. Yeah? For deep lines, you have to use a combination of fillers and lasers, and you know, that's when it comes up. Sometimes we look at the patient, okay, Botox here, fillers here, laser the rest. It comes in a package, and individualized, tailored. Okay? Yeah. This is pigment problem. Now I wanted to highlight this issue. It's called melasma because it's very common, especially in Southeast Asia. Yeah? Especially in Southeast Asia. Melasma. You see, we get brown pigments on the face. It is one of the most difficult conditions to treat. Okay? And most of the time, we cannot get rid of it permanently. We can only reduce it, and it's like for life. You need to maintain whatever medication, the creams that you're taking, to make sure the pigment doesn't get produced as much. It gets worse when you expose yourself to the sun. Yeah? And when you stop using your creams, it comes up back again. So it's one of the most frustrating things to treat. But of course, makeup works. This is one condition where makeups work like magic. Okay? Yeah. So, alright. Now, melasma. Yeah, these are all, I'm just trying to highlight to you, the pigmentation. When people come to see a doctor, I've got a pigment problem. We have to differentiate. Not all pigment problems are melasma. This is called solar keratosis. This is a sun damage, due to sun damage. Solar keratosis. This is seborrheic keratosis. Yeah? So it's different. This one can be treated by laser that cuts. This is one of the good things to have, because once you remove it and that's it, it's gone. It sits on top of the skin, so we have to cut it off. Whereas this one, melasma, is in the skin, so you need the pigment laser to reach it. Yeah? So it's not the same. And you have freckles. Yeah? If I have freckles, I would embrace it. I would wear it with pride. But you know, some people, they don't want to have freckles. Freckles are the other thing that when you treat, when you expose yourself to the sun, it comes back again. Okay? And this is nevus of Ota. It's like a birthmark. Very common in our part of the world. Yeah? Now this can be treated, yeah? This can be treated and get rid of permanently. The beauty of laser. It works. But of course, you need multiple treatments for nevus of Ota. Nevus of Ota. Ota is a Japanese name, yes. The first doctor who described it. Okay? Now, that was laser. There are other things apart from lasers, ladies and gentlemen, in the market. Okay, that is available. Now these, I remember I was talking about lasers, targeting the skin, These are things that targets even deeper than skin. They go down to the fat layer. Things like ultrasound. Yeah? If you want to Google, you Google HIFU, high intensity focal ultrasound. Alright? Or radio frequency technology. These two technologies, they target deeper in the fat, which is why, not only the face. You can treat, you can also, postnatal, after delivery. Yeah. So instead of you asking your husband for a diamond ring, ask him to pay for this. You know why? Because the treatment is very expensive. In Malaysia, one treatment with ultrasound can go up minimum of 7,000 ringgit, 7,000 to 10,000 per treatment. Yes, per treatment. Yeah. So, but you know, if you probably heard about Thermage, those are the names. Yeah, I'm just throwing names. Yeah, Thermage, Altera. These are the kind of treatments. Since they go deeper, so you know they are also used for body sculpting. Yeah, if you want the thigh gap, yes. Yeah, you want the thigh gap. You want the gap next to the knee. Yeah. Yeah. There are people who wants gaps, you know, at the knees. Yeah. And you know, to tighten this up, tighten up the neck, it works. Yeah, it does work. And the beauty of these machines, why it costs a lot, is you can see the effect immediately. Yeah, and then from there, you know, it just improves with time.
How much is that?
You're asking me the machine or you're asking me the treatment?
The treatment.
Yes, it ranges about 7,000 to 10,000. 7 to 10,000.
But it's once, right?
Yes. It's once. But normally, yes, but you know, after a few months, you know, you come for touch-up. Yeah. It's quite painful. Yes, it's quite painful. You feel the heat. You feel very heaty. You know, because how it works is actually it heats up. It heats up the fat. You feel the heat. It heats up the fat. Yeah. And then but it does work. It's immediate. You know, because sometimes, you know, we look at magazines and, oh, I want a body like that, you know, after delivery and things like that. Yeah, everybody wants to look like that. But you know what they don't tell you? They go through all this. The celebrities have got a lot of money. They do all this. And then they tell you, oh, I diet and I drink dew every morning, and you know, they don't tell you that they go through all this, yeah? Okay, those are their beauty secrets. Now you know. Alright? Okay. Alright, before I go to this is probably the last topic. Okay, let's just discuss. Any questions you guys want to ask me about lasers, or you know, any concerns? I can address them if I can. I will address them if I can. Yes.
Sorry to first that.
It's okay.
You were saying about the pH of the skin.
Yes.
The toner and the cleanser.
Yeah.
So the natural pH is like.
The natural pH. Oh.
Is that natural pH?
Yes. I worry about this Kani, you know. He takes notes. No, our natural pH of the skin is acidic. Our skin is very acidic. It's actually 4.7, 4.75. It's even lower than 5. Which is why, you know, things that actually using things making it, you know, very alkalinic substances is not really good. You need something a bit more acidic.
For defense reasons, right?
Sorry?
For defense reasons.
Yes. You see, she has notes. She can go back way before all this. Okay. Yes.
Sorry, about the laser,
Yeah.
is it harmful, and which area of the body is not recommended to do laser?
Okay. Laser cannot. I think the main concern about laser is, number one, people think that worry that it can cause cancers. To be honest, laser cannot penetrate so deep. Lasers can only penetrate the skin level, which is why, you know, in order to treat cancer, let's say, you know, you've heard of radiotherapy. Radiotherapy to treat cancer inside, say for the lungs or something. You don't use lasers because it cannot pass through the skin. It's very superficial. It only acts, you know, that a few nanometer. It doesn't go in. That's why for radiotherapy, they use gamma radiation. They use other energies. Okay. So but laser is so far, you know, it has been used for decades. No reports of cancer has ever been, you know, there's no cancer is not a side effect of laser. And which part? It depends on we're talking about the face, yeah. If you're talking about what other parts can be used, like like anywhere really, because lasers are also used, like the laser that cuts, not only for beauty, it is used to cut other things like viral warts, all those things, those skin tags, those polyps you can have anywhere.
For example, for
Yes.
hair removal.
Yes.
So for example, for armpit.
Yes.
Is it okay?
Yes. A lot of people go for that actually. The hair removal, we do it for armpits, for face. There are people with unibrow that they want to get rid of. Bikini areas, abdomen, yeah, even the chest, yeah. There are some ladies who have, those problems, the back, whatever. Yeah, for hair removal, it's anyway. The legs is quite common, yeah.
So
Legs.
there is no issue.
No. Yes.
Yeah, because I would like to know about those post-inflammatory after you have your lasers.
Yes. Okay.
Is that permanent?
Right. Okay. Post-inflammatory hyperpigmentation is not permanent. It will go off, but the older we are, I find that the longer it stays.
How long is that?
Few months, can go up to a year. Alright? And it helps if you do not expose yourself to the sun after laser, because it makes it stimulates the skin to produce. We're going to talk about it under this skin whitening. The sun makes our skin produce pigments. So it doesn't help if you have had laser, you just had laser, and you go out to lunch and walk, and at 1 p.m. to 2 p.m. you'll be out in the sun. It doesn't help. It will make the risk of having post-inflammatory hyperpigmentation higher. Normally, after treatment of laser, that's why we use creams to keep it down. There are creams, there are serum to try to reduce this. Not everyone. You will know from the past wounds. If you have like mosquito bites and then you scratch them and then you have got a small wound, then how do you heal? You heal with pigmentation? If you heal with pigmentation, then yes, there is a chance that you can get that. Which is why for the darker the skin, the laser power that we use tend to be lower. We start low. And then patients are not happy. Oh, I don't see any result. But we are trying to be safe here. We start low, and we see the result. And then only we slowly, gradually increase the power. Okay? Sometimes it's not that doctor doesn't want to treat the whole face, straight away. No, they're being very careful. You treat the small area and see how you heal first. And if you heal well, not much issue at that power, then they'll do the whole face. Sometimes these are the things that the steps that we take to try to minimize all these problems. Okay? Yeah? Okay, now let's move on. Now, skin whitening, a global phenomenon. Yeah. Where are you from, ladies?
I'm from the UK.
From the UK.
From the US.
Oh, wow, 2 different continents now. Okay, now, because you've just been to Malaysia, this is the craze. This is the craze in Southeast Asia. I think not only in Southeast Asia, really. Yeah? But it's global, right? It's global. Now, I've had patients who come to me complaining of, it's a problem. It's a problem to her because she says, I work in a farm, and when I work in a farm, my skin becomes dark. And I want to stop that. Okay? Do you think I can stop that? Why? Because being tanned is our natural mechanism to protect our cells from damage caused by the ultraviolet light in the sun. What the ultraviolet light does is that if it penetrates your skin, it will damage the DNA in your cells. And that's when you get your skin cancers. That's when you get the accelerated aging, your wrinkles, your pigmentation. So, it is made such that when we are exposed to the sun, the skin becomes darker. And when it becomes darker, it acts like an umbrella, you know? It covers the DNA. It covers it so that the damage stops there. If you lose it, you do things to stop this, then you will have to be careful. If not, you'll pay the price of getting skin cancers, accelerated or premature aging, wrinkling, etc., etc. Okay? So, you are warned. You are warned, okay? So, what UV, ultraviolet, you see, when we talk about ultraviolet, there's UVA and UVB. And they're not the same. When you sit in this room, UVB is blocked by that window. UVA is not. UVA can come right through. UVA is, it tends to penetrate deeper than UVB. Alright? UVA, this is the one. It causes aging, wrinkling, etc. It damages your collagen. Yeah? UVB burns. So, be careful when you're trying to get rid of this natural mechanism. Alright? Now, I mentioned this is the tanning process. The sun penetrates the dermis. These weird red looking things are your melanocyte. This is what produces melanin. It's quite deep. Yeah, it's quite deep. Deep underneath. So, when the sun hits you, it produces melanin. Melanocyte releases the melanin, you get more melanin and you become darker. Do not hate this process. Yeah, expect it to happen. We are blessed with it. There are people who cannot tan. They burn. Yeah? We have this natural mechanism. So, okay. This is a list of all the whitening substances that you can find in the market. Alright. The first one. We don't have much time. Okay. The first one. Hydroquinone. You've heard about this. Yes. It's painted as evil. Evil ingredient by some. Do you know why it's evil? If that's evil, everything else is evil also. Now, in Malaysia, we have lots of products, whitening products on the market. And the moment all these whitening products has hydroquinone, the government will come and seize all. They call it produk mengandungi barang terlarang, prohibited, cosmetic products that contains prohibited ingredients, substances. All right. Now, hydroquinone falls underneath. The problem with hydroquinone works well. The only problem with it, you cannot use it at very high concentration. And you should not use it for a long time. There are people who use it for years and they get problems. The main problem that we fear is that your skin turns grey. You will get grey patches. And this is permanent. No amount of laser can fix it. It is a permanent problem. So when you use hydroquinone, if you use it for a while, for a few months for instance, for a few weeks, no problem. Just don't use it for decades. In Malaysia, it is being regulated. Only 4% or below is allowed. Anything more than that people would love it because it works so well. It bleaches your skin. It works fantastic, but normally it has got a higher concentration. Anything more than 4% is considered not allowed in Malaysia. Because you get more problems. That's when the grey color, discoloration comes quicker. Alright? So that is why, some products have been banned. There was a cosmetic, another cosmetic millionaire, but she was murdered a couple of years ago. At the time of her death, actually, there were pending court cases because some of her products had hydroquinone. Okay? Alright. Mercury. Now, mercury is neurotoxic. Did you know that? Mercury is neurotoxic. It is toxic to your nerves. In the olden days in London, the most mercury, it is like they call it the people who have mercury poisoning, they are called mad hatters. Because in those days, people were making hats and they have to paint mercury of some kind. And what they do is when they paint it, they lick the brush and then they paint it. and they ended up having mercury poisoning. And they become, yes, become mad. So they call it mad hatters. Mad hatters. Mercury poisoning. The problem with mercury is it is absorbed very well through your skin, but the fumes, everything, it goes through just directly. It is toxic to the nerves. And yes, until now there are products out there being sold that has mercury. And people are using it, oh, I like this because it makes me white. Okay? Kojic acid, now no exciting stories about kojic acid. It's one of the legit ingredients. Legit, yeah? Isotretinoin, okay. This is actually from vitamin A. Okay? It's from vitamin A. It can whiten the skin. A lot of product contains it, but why are some products being pulled from being sold out there when they cause isotretinoin? Isotretinoin is harmful for pregnant mothers. It can cause deformity to the baby. Okay? So, but it works. So if you are pregnant, ladies should not be using anything that has isotretinoin, even though they are in form of a cream. And in order to curb this, to control this, that is why products that contains isotretinoin is banned. But it is not banned when it is being given by a doctor, because a doctor can tell you, this is what you should not do, this is what you should not be. You should not be pregnant when you're taking this, when you're using this. If you're pregnant, somebody can tell you that. But if you get it off the shelf, people don't care. Nobody's going to tell you about this. All you care about is getting white. Getting white skin, and that's it. Okay? Now, these are, liquatine comes from licorice root. Right? Talk about organic now, right? Arbutin is also the name of a substance. It comes from a berry, bearberry. This is apparently how it looks like. I've never seen it in my life, but this is how it looks like. Vitamin C, yes. Yeah? Vitamin C, the one applied on the skin works best. But recently, in Malaysia, there was a big hoo-ha about government trying to stop people having vitamin C injections. It's because it is associated with other risks. You can have kidney stones. It can hurt your kidney, it can hurt your liver when you use supra high doses. Because people go for injections because when you take orally, or you can't take so much. You need a higher dose to make yourself white, and so okay, we give you injections, and then you get the problems. Okay? Tranexamic acid is a scary medicine. When I found out that people are using tranexamic acid to make themselves white, I got the shock of my life. Tranexamic acid, for a conservative doctor like me, we use it only to stop bleeding. If you have periods, very heavy periods, non-stop, we give tranexamic acid. If a patient bleeds after a major surgery, we give tranexamic acid to stop a major bleeding. Can you imagine suddenly people are using it for whitening? Okay? What happens when you try to stop bleeding? It makes your blood clot. So what happens if you take something that promotes blood clotting? Yes, it increases your risk to have heart attacks, strokes, God knows what else. Okay? But hey, it makes us white. Who cares? Right?
In California, where I'm from, people lay out the sun to get dark. So it's
I know. That's why but it's a phenomenon here. Yeah. So you see, the grass is always greener. We want to be like you. People are going to the extra mile to be white and to be fair. And there we see a lot of Caucasian tourists coming here, and they just lie down at the beach and trying to get themselves tan, and we look at that crazy Mat Saleh, we say, trying to expose themselves. Here we are trying to hide away from the sun. So,
Well, in our culture, a tan or having dark is seen as being healthy. When people come back from the holidays and they've been laying in the sun getting cancer, they're like, oh, you look really well, really healthy.
yeah, I know. Here they want to be fair,
Yeah.
because when you're fair, people think that you're well-to-do, and I don't know. I agree. I think we should look healthy, not fair or dark, or don't give it a color, a name to it. Just look healthy. whatever color you are. But that's me. All right, now I'm talking about glutathione. This is very famous. Glutathione. I can be very, very rich and not stand here and give you a talk if I were to sell glutathione. Okay? Glutathione started out as a medicine that we use to neutralize patients who have like a Panadol overdose to save their lives, because it's a very powerful antioxidant. Yeah? Or we use it to neutralize side effects of chemotherapy. Certain chemotherapy, they get side effects, yeah? So we give, it started out as medicine, and then when they found out that, hey, we give high doses of this, and patients, when we discharge them, they become white. They became fair. And that's when the idea comes in. Okay? Okay, lycopene, you find this in tomatoes. Tomatoes, yeah? This is legit, okay? You just eat lots of tomatoes. But there are also now products that has lots of lycopene inside. This is pycnogenol. It comes from a pine bark, a bark of a tree. There's one study. It's quite small though, but the study was done in a few countries in Southeast Asia, in Philippines, in Malaysia, that showed that it worked. But of course, the studies are small. We don't know what effects it brings in the long term that comes with long term use. You also have this long name, I wouldn't even try to pronounce it, proanthocyanidine, rich extracts from all the berries. Yeah? Now we know why the Europeans are fair, isn't it? They eat a lot of berries. We don't get any berries here. Yeah? And resveratrol is found in grape skin, so it's found a lot in the red wine. Alright? Now, please don't quote me. I'm not promoting the Muslims to drink red wine. I'm just stating that it's found in grape skin, and there's a high concentration of resveratrol in red wine. That's all. You'll never know with all these cameras going around, yeah? Okay, as I said, glutathione is actually started out as medicine for to combat the side effects of chemotherapy, cisplatin, yeah? But, okay, it was an accidental discovery, yeah? The whitening effect is actually an accidental discovery. Usually, glutathione is marketed not as medicine when it's used for whitening. It's not marketed as medicine, it's marketed as dietary supplements, okay? Right? One thing that you should know, the moment a substance is marketed as a dietary supplement, not a drug, the company doesn't need to prove that it works. Okay? Only when you want to sell something and you say, oh, this is a drug, then you have to prove that it works. You have to have research. But when you say, oh, this is not a drug, this is only a supplement, you don't need to prove anything. It can contain mercury. You don't need to prove anything. Nobody's going to check. Alright? Alright. Tranexamic acid, I told you. Now people are using it for whitening. I find it scary. Yeah, that people actually use it for whitening, whereas we use it to stop excessive bleeding. So, people say not safe to use it for a long duration. I wouldn't use it at all, to be honest. Yeah? Okay. Okay, now why do you think, there are some people come up to me and say, Doctor, do you inject vitamin C? And I just say, I'm so sorry, I don't give injections of vitamin C for whitening. And you know why? Because most injections for skin whitening are not approved by any FDA, food, drug, bureaus, things, authorities that regulates food and drugs. There's no FDA in the world that says that injecting substances for whitening is safe. Yeah? And there is no scientific evidence of their use exist. I can look up the journals. Just type in intravenous or injections for whitening. There's no paper. For tablets, yes. Alright? That's why we don't. I don't give at least. Most doctors, most dermatologists don't. The ones who normally gives it are beauticians. Yeah? Some doctors do give it though. But as far as I know, dermatologists don't. Alright? Now, Because now these things usually cost a lot of money. So patients, they tend to buy, this place they sell a cheaper one. Be careful. Those can be counterfeit, substances, drugs, and sorry, not drugs, substances. And then when you get injected by untrained people, because you want to cut cost, then the problem comes. Yeah, that all these infections who can come in. Yeah, and one thing that you should know, and I think I did mention it before, when you whiten the skin, one of the effect that it does is that it switches. Our skin produces melanin, but it produces a less efficient melanin that does not really protect your DNA. Okay, you have more, you still have melanin, but it's not the very efficient kind, because you are suppressing the production of the efficient melanin. So be careful. Alright, I took this screen capture from a Malaysian pharmaceutical website. Okay, the list of, just to give you an example, you can actually check this out. These are the names of the product in Malaysia, and they list it out as cosmetic products. When it's cosmetic product, they don't need to prove to you, they don't need to produce any research and anything like that. Yeah? And this is the reason why, what they contain. You can actually go to the website and you can check it out. These are the things that it contained and why they were pulled out from the market. Now, again, I have to tell you, hydroquinone and tretinoin is pulled out not because it is harmful, They have their strengths, they have their problems, but they can only be used under supervised care when it is being given by a doctor. It is not supposed to be, to be easily available anyway, because tretinoin can harm an unborn child. It can make it handicapped, giving it birth defects. This kind of thing should not be on the counter and anybody can have access to it. That is why it was withdrawn. Okay? Now, this is in 2017. It's only April. It's only April, and this is the list of things that so far the health ministry has identified and ordered them to ban them, basically ban them from selling. Okay, look, it has mercury. You know the picture of that beautiful lady with the cosmetic millionaire I showed you? Yeah, last year two products from her company was banned because they contain mercury. But I didn't include her products here because it was in 2016. But you see, even this year, there are still people buying, you can actually still get mercury. You can still go out there and get yourself mercury poisoning if you want to. So please be careful. And this is the website where I got that from. Yeah? So there are websites here. I'm sure you are all internet savvy. You can use them. Yeah? And this is in Malay. Sorry about this. I just cut and paste. There is a helpline, sort of, that you can actually report if you have problems with cosmetic products in Malaysia. You can email, because these things, when you talk about cosmetic products or supplements, no investigations will be done unless somebody files a complaint. You make somebody complains about this, only then they will take the cosmetic product and look into it. Alright? Now, most product they say, kami berdaftar under KKM. Yes. Sorry, what it means is that most of these products are registered under Health Ministry. What it means is just that I'm going to sell product A. I'm going to sell product A as a supplement. So, I register. I pay 50 ringgit. I register. I get a number. That's it. That's all. Now I can sell it. I'm registered. It doesn't mean that it's safe. It just means that it's registered. Okay? Yes.
You mean there's no IND in it?
No, because it's not a drug. It is marketed as a supplement, marketed as a, what else? all these terms, cosmetics, only drugs need to be proven by research papers and all that. Only when it comes under drugs. If it doesn't come under drug, there's no need for them to spend so much money. Okay? So these are the difference. Okay. Anyway, so to just sum up, I just want all of you, when you leave this room, I've talked about a few treatments. So just be aware that some of the treatments that I showed, the effect are not long-lasting. Just like diabetes, When you have diabetes, you have to take the medicine every day for the rest of your life. The moment you stop, your blood sugar goes up. The same goes for whitening. Yeah? The same goes for any treatment for whitening. The same thing that goes for like melasma. Yeah? So there are diseases that needs to be, to be maintained. The same way, like, when you do like rejuvenation, things to rejuvenate your face, you stop doing it for a couple of years, your skin will go and, run its the natural course. Okay? Alright, most of the treatments that I mentioned, the beauty treatment, they are costly. Yeah? And insurance doesn't cover them. As I said just now, ultrasound or radio frequency, ultrasound can go up to 7,000 to 10,000 per treatment. Yeah? So you don't have to break the bank for this. Whiter does not mean better. You can listen to our friend here from the UK. Being tan looks healthy. We prefer being pasty. I don't know why. Okay, the Malaysians crave looking pasty. I don't know. Okay, just be careful. Certain products cause harmful substances, but they are harmful. I've listed out some of the products. I've talked about those products. And, seek professional help. Now, professional help, this is a website. Now, I just want to highlight here. There are not many dermatologists in Malaysia. There are just over 100 of us to cover 20 over million people in this country. Reason why, you might ask, because number one, the training takes so long and so difficult. Yeah, in Malaysia we have to be physicians first. Yeah, you have to be a physician, a specialist in internal medicine, and then you add on another 3 years, and then you become a dermatologist. That's why you don't get young dermatologists in Malaysia. You only get old ones like me, okay? But if you want to look for a real dermatologist, go to this website. There is a directory of dermatologists. It tells you which state you are. These are the doctors that are the real dermatologists. Some doctors are not dermatologists, but they call themselves that. Okay? Alright? Alright. Okay? So, ladies and gentlemen, I hope when you go out, you leave this room, after listening to me for almost 2 hours, please, the quest for beauty is never ending. Okay? But be realistic. Yeah? Everybody wants to look like I don't know who, Sofia Vergara? But even Sofia Vergara wears makeup. And we want to look like her when she's on the red carpet. And she has a whole team of makeup artists, and she goes for treatment, like a few weeks before that moment. And we want to look like that every day when we wake up from sleep. Be realistic. Okay? Be realistic. And have a healthy expectations. Be aware of the myths. And be smart. Thank you.
Thank you.
Thank you, Dr. Mazlin. Okay, we are open for questions. If there are